Welcome to Healthy Living in Lowell, a production by Lowell Health Department and its community agencies. My name is Daniel Howell, and I'll be your host today. Today we have 3 presenters who are going to be talking about syringe and shops programs that are happening in Lowell. The first panelist is Lainnie Emond, the substance abuse coordinator from Lowell Health Department. We have Andres Gonzalez, who is the syringe collection program coordinator. Hello. And we have Carrie Nagle, who's the program manager of the community department in Lowell Community Health Center. Can you guys all say hello?
Hello, everyone. Hello.
How you doing? Thanks for having me.
So we're going to start off by, I'm going to direct this towards Andres.
Yep.
What exactly is a shop or a syringe?
Well, a shopper syringe is a medical device with a hollow needle on top of a little plastic cylindrical object that's used to withdraw or inject medication or fluids from the human body. But today what we're going to focus on is the unintended use of illegal drugs in these syringes.
Okay, excellent. So why exactly did Lowell create a syringe collection program, and what exactly is that?
City leadership saw the need to have a concise protocol when it came to responding to discarded syringe pickup requests, as well as needed an individual to educate the community on proper sharps, disposal, and safe storage.
Excellent.
Yeah, and in addition, we needed an individual or a point person within the city, specifically it was the health department that took on this role, to educate youth and families and provide support at community events and to community partners throughout the summer, throughout the different seasons, especially when we're outside.
Wow, that sounds really fascinating. To kind of tag on to Carrie, what exactly is the syringe service program?
A syringe services program, or an SSP, is just a way for community members who are actively injecting drugs to have access to sterile syringes and other harm reduction materials. It is a safe location for individuals to safely discard of their syringes into a locked syringe disposal kiosk. SSPs reduce the use of using or sharing dirty needles and other equipment that could be contaminated with infectious diseases, to prevent the risk of spreading them. SSPs also allow outreach workers to provide educational services in an environment that clients are most comfortable in, or a term that we use is meeting the clients where they're at. It allows for information to be provided on local substance use disorder treatment facilities, more commonly known as detox facilities, so we can connect them to Tewksbury Detox or other detox facilities in our area. The CDC also estimates that individuals that enter an SSP site are 5 times as more likely to actually enter into a substance use disorder treatment facility. So we can also help connect those individuals to get treatment for the use of drugs.
With all of that being said, does Lowell have one of these programs, and is it important that we have one of those?
We do. So there was an HIV epidemic that started in Lowell and Lawrence back in 2015, and that was directly linked to opioid use, specifically with injecting opioids. And Lowell has seen a large increase in non-fatal and fatal overdoses over the past few years. Therefore, back in November 2018, in order to help with this continuing epidemic, Lowell Community Health Center was awarded funds through the DPH, Massachusetts Department of Public Health, in order to have a syringe services program. Luckily, Life Connection Center, located on Appleton Street, already had been piloting an SSP site for over a year at that point. So the implementation for an SSP site, though it had a lot of steps to it, it was a little bit easier in that sense. Life Connection was already providing meals Monday through Wednesday for the homeless and at-risk populations, and that way we were able to really establish this SSP site to decrease infectious diseases that are transmitted through the use of dirty needles, so people have a place to actually go and dispose of their needles. And it's also a place where a lot of education is able to be shared with this high-risk population that they might not get in other locations that they're residing.
Okay. Thank you, Carrie. So back to Andres. So how do you properly dispose of an unwanted syringe?
It's a public health concern. So the best way to store or discard of the needles is to put them in a puncture-proof container, usually laundry detergent, but something that has very thick plastic, a coffee container, and seal it up and wrap tape around it so people know that it's a sealed container and that it shouldn't be opened again. And then take it to one of the many places in our city where you can discard of the container itself.
Okay. And could you or one of the other panelists please explain a little bit more about why we would consider this a public health concern?
Well, there's a lot of reasons, actually. People usually don't really think about discarding needles the appropriate way, so they might throw them in the trash. And one of the concerns there is that you know, you could be throwing out the trash one day and you can accidentally prick yourself with a sharp or a syringe. I myself, at my home, I have a diabetic daughter, and it's actually happened to me. You know, so I've actually lived through this scenario itself. You know, and I took it as a learning moment for myself and my daughter to teach her. You know, what the circumstance was and what happened. And you also got to think about our city employees. Our city employees also discard of trash. You know, they could be at risk of being pricked with a needle, exposing them to a virus or disease. And you also got to think about our landfills where we put our trash as well. You know, you have syringes are made out of plastic. They're not biodegradable. You know, they'll sit in our landfills. You have animals that can come and also be affected by a syringe. So those are some of the reasons alone why, you know, this is starting to become a public health concern.
Okay, so with the example that you just shared with us, as well as for everybody else who's watching at home, who can we call or where can we go to discard unwanted sharps and syringes?
We have 5 locations in our city right now where they have kiosks. The Lowell Health Department, of course, we have a kiosk there. We have at the Lowell Senior Center, Lowell House Addiction Treatment and Recovery Program, and the Lowell Regional Watershed Utility also accepts syringes, and you can. They all have different schedules. We do have the information that will be posted where you can choose to drop off to any one of those locations. So people can join us for our Unwanted Meds and Sharps Collection Day on August 13th. It'll be from 2 to 6 at the Health Department in Lowell, 341 Pine Street. Again, that'll be 2 to 6 at the Lowell Health Department.
And to add what Andre is saying, it's important that we're talking about proper sharps disposal, because sharps are in our homes. They're a part of our everyday life in some cases. You know, we don't talk about this enough. The conversation right now seems to focus heavily on discarded syringes that are found in the community, specifically related to IV drug use. But as Andres had pointed out earlier, sharps are used for a lot of medical conditions, and they're practical and they're realistic, and some people need them to just function every day. So knowing where, knowing where we can discard sharps, regardless of the purpose of why they're being used, is extremely important. And we need to get this information out into the community as best that we can.
And sharps come in many different forms, EpiPens, lancets. So people usually just think that a sharp is the syringe, but they could come in different forms as well, so such as the ones I just named.
Excellent. So Carrie, I just wanted to, with the Safe Syringe Services Program, a term that we hear a lot about is harm reduction. Why is that important, and why should I, as well as the residents of Lowell, care about harm reduction?
So harm reduction is a way to reduce risk. For instance, we wear seatbelts in the car, so if there's ever an accident, we don't get hurt.
Yes.
So harm reduction, when it relates to intravenous drug users, is being able to help them be as healthy as possible with the act of injecting drugs. So harm reduction can take many different forms, one of them being an SSP.
Okay, perfect. So can you tell us a little bit more about SSP, or Safe Syringe Program, the Syringe Service Program, and who else is involved with it? What are the hours and locations for it?
right now, Life Connection Center has syringe service exchange Monday through Thursday, 11 to 3:30 in their physical location at 192 Appleton Street. Then we have the Life Connection mobile exchange that occurs at various locations, and there is a phone number that you can call to find out where they are in the city, and that occurs on Tuesdays and Thursdays, 8 to 5:30. Then we have Health Innovations at the Lowell Shelter on Mondays and Wednesdays, Mondays from 10 to 3, and then Wednesdays 11 to 5. And then we have the Healthy Streets mobile van on Monday and Wednesdays, Mondays from 10 to 3:30, Wednesdays from 12 to 8, and then Fridays from 10 to 3. Healthy Streets is also going to do once a month an overnight clinic in order to get individuals who might be out late in the community access to sterile syringes and other health services.
So at these clinics and different centers, what services are you guys providing there?
So we provide a variety of services, and it also depends on what you're being funded for. For instance, the SSP that Lowell Community Health Center and Life Connections is funded for, we provide testing for STIs and HIV. We are able to provide nursing assessment for wound care, and then be able to refer patients to the health center for appointments. We can actually walk patients over and have a warm handoff to clinicians and providers at the health center, because even just the walk from Life Connections to the health center is a big barrier for a lot of people. We also provide condom distribution and other safe injection harm-reducing materials for clients as well.
And to add to Carrie's point, one of the great things about the Life Connection SSP and SPs in general is there's that direct linkage to service. As Carrie said, there are a lot of barriers. Even just walking from Appleton Street to Jackson Street can be a huge barrier. And having multiple providers and multiple agencies in one spot to help connect to services is absolutely essential.
So with these connections to services, are these confidential, or is my information being kind of just left out there?
Your information is always confidential, so the policies that the Lowell Community Health Center abides by, we abide by HIPAA, so we definitely abide by that over at Life Connection Center as well. We are still using, for testing and for any appointments that we book, our eClinicalWorks. So we use the same confidentiality that we would as if you were actually in the physical location at Lowell Community Health Center.
So the last question for today. So what should I do if I found a discarded syringe?
First and foremost is do not touch it. And we can't stress that or emphasize that enough. There are a lot of people in the community who are very eager to help, very eager to keep the community clean and safe, and they think that they can, pick up a syringe and discard of it, but we're saying don't do that because they might be exposing themselves to any kind of being pricked and exposing themselves to a bloodborne pathogen, a disease, or a virus. And so the first thing that we're stressing, and that's why I'm saying it again, is do not touch them. Secure the area. Make sure you let people know that there's a syringe present. That way children are protected and any other residents in the community are protected. If you could find some kind of casing to put it over it, or some kind of marker to let whoever is going to come pick it up, which would be the syringe collection program during city hours. You call our phone number that we're putting out there. It's 978-674-1049, and we'll come right over and we'll pick up the syringe. On non-city hours, we're also working in conjunction with Trinity and the police department, and you call the non-emergency number, which is 978-937-3200, and they'll make arrangements with Trinity to come by and pick up the syringe. And we're doing everything we can to clean up the city and keep it safe for children and residents. So do not touch the syringe. Call the number provided from the health department or the non-emergency police department. And we can't stress enough, don't touch the syringes. We want to keep everyone safe in the community, and just call the numbers that are provided, and we'll take care of the syringes. And we're also doing sweeps of parks, riverways, alleys for the ones that aren't seen in the community. So that way we could attack this issue and keep our beautiful city clean and safe for everyone.
Mm-hmm. And to echo Andre's point, and really just to emphasize, do not touch sharps if you see them in the community. Andres, as our syringe collection program coordinator, has been trained, equipped, and medically cleared to respond properly to discarded syringes that are found in the community. And in addition to what Andre was saying about calling to report a discarded syringe, you can call him directly at
978-674-1049 is the number.
Mm-hmm. And he will respond as soon as possible.
Yep.
And then off hours, again, to echo what Andre was saying, call the non-emergency Lowell police number. Do not call Trinity 911 directly, although Trinity will be responding if they have an available ambulance and staff to respond to the request. They do not get requests directly. Do not call 911, call the non-emergency Lowell police line.
Excellent. Before wrapping up, do any of the panelists want to say one last piece?
I actually just want to bring back harm reduction real quick and just kind of echo that we're not having an individualistic approach when we're talking about harm reduction, but how it relates to the health of our entire community and entire public. By being able to have syringe collection programs and have SSPs, we're really able to provide services to those most at risk. And once we're able to help the health of those most at risk, the rest of the health of the community rises. So I just want to reiterate that these types of programs not only help those that are in need of them, but will also help all of us become a healthier community.
Mm-hmm. And another last comment, when we talk about syringes and SSPs and needle exchange, an important thing to note is that by contract with DPH, our syringe service programs have to take in more syringes than they give out. So that is extremely important to know, that syringes aren't just being given to community members. They're actively being collected on a 1-to-1 ratio, as well as the 2 SSPs that we have in Lowell are going out to collect extra syringes. And then in addition, we have Andres' role, who is going out and collecting more syringes. So I think that's a fantastic, fantastic way to add to the harm reduction piece and to better our community as a whole.
And the syringe collection program isn't just going out and collecting discarded needles when they're reported. We're also supporting all the organizations in the city that have anything to do with cleanups. We're getting out into the parks and supporting cleanups through the neighborhood associations. We're also supporting schools and educating children as well, or any kind of program. When I'm out in the community and people approach me and ask what I'm doing, or they already know what I'm doing, there's always time for educating them about the dangers of syringes. So on top of being a collection program, we're also doing the education piece and supporting community events with passing out information, letting them know about the program, and educating as well. When I'm in the parks, doing the parks, I'm always talking to the kids in the parks. Hey guys, make sure you pay attention, look, and I let them know. So there's constant educating going on through the syringe collection program, and there's constant support of other community groups who do cleanups on the weekends at parks or the canals. There's canal cleanups coming up, and we're going to be there to support all these programs and events to make sure that people are safe and we're tackling the issue as well.
Excellent. Well, I just want to thank you, Carrie, Andres, and Lainnie, for joining us today on Healthy Living in Lowell. So thank you again for everybody watching at home. Today we were able to go over 2 wonderful programs, our Syringe Service Program, SSP, and our Syringe Collection Program, that are both being run by Lowell Community Health Center, Life Connections, and the Health Department in Lowell. Please join us again next month as we go over even more topics that are happening in Lowell. Thank you.